Bismillahirrahmanirrahim. My name is Dr. Taimoor Hassan from Anatomy Department. Today the topic of my discussion is the cranium. First of all, we will outline our learning objectives. What are the learning objectives of today's lecture? Are what are the anatomical features of lateral aspect of the cranium? Enumerate the bones of the norma lateralis. What are the boundaries of temporal fossa? Give the anatomy of occipital aspect of the cranium. What are the sutures and bones of norma occipitalis? What is the anatomy of superior aspect of the cranium? And with this, what are the sutures of superior aspect of the cranium? First, we will discuss the lateral aspect of the cranium. In lateral aspect of the cranium, we can see the first of all we can see the bones which are involved in the lateral aspect of the cranium. Here you can see the frontal bone. Here this is the parietal, this is occipital, this is temporal, this is sphenoid bone, its greater wing, this is zygomatic bone, this is maxilla, this is nasal bone with the and this is mandible. With this, the most important structure in the lateral aspect is the zygomatic arch. Zygomatic arch is formed by the union of the temporal process of the zygomatic bone, temporal process of the zygomatic bone, and the zygomatic process of the temporal bone. You can see here this is both processes unite to form the zygomatic arch. With this, in the lateral aspect of the cranium, the next most important structure is the temporal fossa. Now, what are the boundaries of the temporal fossa? You can see here it's superiorly and posteriorly the temporal lines. Superior temporal line, which is blue, and with green you can see here the inferior temporal line. Superiorly and posteriorly, both these lines form the boundary of the temporal fossa. Anteriorly, you can see frontal and zygomatic bones forms the anterior boundary, and inferiorly you can see here the zygomatic arch. So this is the area which is shaded with green on the lateral aspect is called the temporal fossa. Next important structure in the lateral aspect is the pterion. You can see here it is a H-shaped. Pterion is a H-shaped junction or union of the bones which is in the anterior part of the temporal fossa 3 to 4 centimeters superior to the midpoint of the zygomatic arch. This S-shaped formation of the sutures where you can see in the diagram the coronal sutures and squamous sutures unite here to form the pterion. Now, here bones which unite here the pterions are frontal, parietal, sphenoid, and temporal. Here frontal bone, this is parietal bone, this is temporal, and this is sphenoid. So all these bones are here unite to form pterion. So the occipital aspect. Now our next learning objective is the occipital aspect of the cranium. Bones which are involved in the occipital aspect of the cranium are parietal bones, occipital bone, mastoid part of the temporal bone, and the sutures which are involved here are the lambdoid suture, occipitomastoid suture, and parieto-mastoid sutures. Now you can see in the here in the diagram this is called the sagittal suture. You can see here this is lambdoid suture and it is occipitomastoid suture with the mastoid bone. Occipitomastoid suture, parieto-mastoid suture. This is you can see in the diagram here, and this is the lambdoid suture. So bones, regarding bones, you can see here both are the parietal bones. This is occipital bone and the mastoid part of the temporal bone with the mastoid process. So the occipital bone, it has some other features which has external occipital protuberance. You can see here in the diagram. This is called external occipital protuberance. Here you can also see external occipital protuberance. With this external occipital crest, this is external occipital crest, descends from the protuberance towards the foramen magnum. You can see in this diagram, descends from the external occipital protuberance towards the foramen magnum. With this, you can also see here the superior knuckle lines. This is superior knuckle line. This is inferior knuckle line. Superior knuckle line and inferior knuckle line. So, our next point in the occipital aspect of the cranium is the lambda. What is lambda? Lambda indicates the junction of sagittal, this is sagittal suture, and the lambdoid suture. So this is point is called the lambda. The next point in the occipital aspect is the cranium. Inion. What is inion? Inion is a craniometric point defined by the tip of the external protuberance is the inion. So this is the inion. This is occipital bone. This is external occipital protuberance, and this is craniometric point, which define the tip of the external protuberance. So this is the inion. Now our next structure is the superior aspect of the cranium. In the superior aspect of the cranium, you can see here the bones which are involved in the frontal bone, occipital bone, and the parietal bone. Suture which are involved in the superior aspect of the cranium are coronal suture, sagittal suture, and the lambdoid suture. Now here you can see the bones which are involved here. First of all is the frontal bone. This is parietal bone, right parietal bone and the left parietal bone, and this is the occipital bone. Suture which are here, you can see here coronal suture, this is sagittal suture, and this is the lambdoid suture. Here you can also see the parietal foramens in the parietal bone. So this is all about the superior aspect of the cranium. Thank you.